Well, thank you. Mr. Robert Befidi, Jr. is a global senior executive with more than 25 years of leadership experience across healthcare, industrial, and technology-enabled sectors. He serves as president of DEXIS and Envista Holdings, where he leads a portfolio of category-defining dental imaging and diagnostic technologies, including 2D and 3D X-ray, intraoral scanning, AI, cloud, IoT solutions that shape the future of digital dentistry. Mr. Befidi has led multi-billion-dollar businesses and held the titles of CEO, President, General Partner, and senior leadership roles spanning strategy, marketing, mergers and acquisitions, private equity, digital transformation, and software engineering. He is known for inspiring global teams and driving turnaround transformation and growth across healthcare, medtech, industrial, and technology-driven markets. Prior to Envista, Mr. Befidi held several senior executive roles at 3M. Earlier in his career, he worked in a private equity, consulting, investment banking, research, and software engineering roles. Mr. Befidi holds an MBA with honors from the Wharton School, an MS in software engineering from the University of Minnesota, and a BS in computer science summa cum laude from Winona State University. Outside of work, he is an avid cook and a world traveler. Please join me in welcoming Mr. Robert Befidi.
Dean Licari, thank you for that generous introduction. I have to adjust the mic a little bit. And for the invitation to share this momentous occasion with the Roseman University of Health Sciences College of Dental Medicine. Your leadership and commitment to building the next generation of dental professionals is evident in every graduate seated here today. This institution is fortunate to have you at its home. To President Kaufman and the board members in attendance, to the distinguished faculty and staff, to the mentors and clinicians who pour their expertise and their hearts into this institution and its students, thank you. What you do here extends far beyond the classroom. You are, in the most literal sense, shaping the future of dentistry. To the families, partners, and friends gathered here today, you are co-authors of this achievement. You absorbed the anxiety before exams, you provided meals during marathon study sessions, you offered patience when patience was in short supply, you believed even on the days when they may not have. This degree belongs to you as much as it belongs to them. And to the Roseman University of Health Sciences College of Dental Medicine, class of 2026. Good morning and congratulations. Today is yours. You have earned every element of it, every late night lab session, every moment of self-doubt that you refuse to let stop you, every patient encounter that quietly tested your skills and your composure. You have been transformed by this journey, and yes, you now have logged more hours with your hands in the mouth of strangers than most people will in a lifetime. A testament to your extraordinary dedication and the preparation for this moment. Today is yours. Personally, it is a genuine honor to stand before nearly 100 graduates who are, as of today, stepping into one of the most trusted and consequential roles in all of healthcare. Dentistry is at once a precise science, a refined craft, and a deeply human service. What you are celebrating today is multifaceted. It is the acquisition of clinical knowledge, as well as the formation of character, judgment, and professional identity. I come to this moment from a particular vantage point. I grew up in a family of clinicians. As a child, at our family dining table, in addition to casual conversations about friends, family, school, and sports, I was often unknowingly immersed in a seminar in clinical outcomes, in ethics, and in the weight of responsibility that comes with caring for another human being. From a very early age, I understood that working in healthcare was not merely a career, it was a calling. As a pediatrician, my father took care of other people's kids. One of those cases that stayed with me over the years was when he took care of conjoined twins. For weeks, it was all my parents talked about. To this day, I still have vivid memories of moments in hospitals and at home about that time. I can still picture those babies, feel the care that my father had for them. I can still smell what the day felt like. That calling ultimately led me into the ecosystem that surrounds and enables clinical work. Personally, too many hours and days and weeks spent waiting for my parents in hospital halls and offices kept me from aspiring to myself being a clinician. Today, I lead a medical technology company focused exclusively on dentistry, which means the instruments in your hands, the imaging systems guiding your diagnosis, the materials you will use to protect, to restore, or to transform the patient's oral health are the very things my colleague and I work on every single day. Broadly speaking, I've spent my career in healthcare, including medical technology, life sciences, medical devices, and dentistry, thinking about one question: how do we give clinicians the tool they need to deliver the care that is more precise, more predictable, and more patient-centered to improve clinical outcomes? So when I look at you today, I do not just see the next generation of dental professionals. I see the people we innovate for, the people we build for, the partners we work with. You and your future patients are the reasons why my work matters. I want to offer you 3 principles on your graduation day. Think of them as convictions drawn from years of experience spent at the intersection of clinical practice and the technologies that enable it. The first principle is this: your instruments are an extension of your hands, and your hands are an extension of your values. Choose accordingly. In my work, I've had the privilege of watching gifted clinicians in research facilities, in teaching hospitals, in private practices, and in health centers. And I can tell you that the best among them share a trait that has nothing to do with clinical acumen alone. They are intentional. They are intentional about the protocols they follow, the tools they select, about the standards they set for themselves and for their teams. Quality is a professional commitment. Patients cannot read dental x-rays. They cannot evaluate your preparation margins or critique your composite laying technique. But they feel the difference in how they heal, how they function, and how they experience the care under your hands. When you invest in excellence, in materials, in technology, in your own continuing education, you are making a statement about what your patients deserve. Make that statement loudly and make it every single day. The second principle is this: excellence is not an event. It is a disciplined practice in the ordinary moments when no one is watching. In dental medicine, the true separator between adequate care and exceptional care is not found in the grand gestures. It's found in the diagnostic rigor you bring to the routine examination. In the exam treatment plan you agonize over because you want to get it exactly right. In the second opinion you seek because the case deserves more than your first instinct. It is found in the habit of asking for every patient who sits in your chair, not what can I do, but what should I do. Your legacy as a clinician will not be defined by the volume of patients in your practice, or the revenue you generate. It will be defined by the accumulation of those individual decisions made thoughtfully, made honestly, made in service of the person across from you. That is the architecture of a legendary career. The third principle is perhaps the most enduring. Your reputation is the compound interest of every choice you make when no one is holding you accountable but yourself. There is a saying in dentistry that I find both humbling and clarifying. When I do good, no one seems to remember. When I do bad, no one seems to forget. I would submit to you that this is a privilege in disguise. It means the standard is clear, it means integrity is not optional, and it means that every restoration you make, every crown you place, every extraction you perform, every patient interaction you conduct is an act of authorship. You are writing your professional story one procedure at a time. Trust in healthcare is the medium through which all healing occurs. Protect yours with the same precision you bring to your clinical work. As I prepare to close my remarks, I want to speak to something that no accreditation standard can fully measure and no board examination can fully test. And yet, it may be the single most powerful clinical skill you possess. Patients will come to you in many cases at the edge of their comfort. Dental anxiety is among the most pervasive in all of medicine. Speaking from personal experience, patients will sit in your chair having postponed their appointment for months, perhaps years, out of fear. They will be in pain or embarrassed or bracing for a diagnosis they're afraid to hear. They will be vulnerable in ways that we may not have words for. In those moments, they will come, and often your most essential instrument is not going to be your tray. It's going to be in the quality of your presence, the steadiness of your voice, the way you make a person feel seen before you begin any procedure. The greatest clinicians I've encountered in the industry understand something profoundly. Beyond treating a tooth, they are treating a person who happens to have a problem with a tooth. That distinction, lived out consistently, is what perhaps separates the technically proficient from the truly exceptional. Listen before you look, explain before you act, reassure not just clinically, but humanly. Class of 2026, you're entering a profession that is changing faster than at any point in its history. Artificial intelligence is reshaping diagnostics. Digital workflows are transforming the way we plan and deliver treatment, and new materials are redefining what restorations can achieve. The practice you build over the next decade will look different from anything that came before it. However, here's what I know with certainty from my years in healthcare. Technology will continue to evolve, and the most important things will remain constant. Patients will always need someone they trust. They will always need the clinician who shows up for them fully, with skill, with honesty, and with care. No algorithm will replace that. No device will replicate it. That is yours, and it is irreplaceable. So as you leave this ceremony and step across the threshold in your professional lives, I want to ask you to carry three things with you. The commitment to excellence that got you here, the integrity to hold that standard even when no one is watching, and the compassion to remember that behind every chart, every case number, every 2D or 3D dental x-ray, there is a human being who chose to trust you. Honor that trust every single time. You will restore smiles. You will relieve pain. You will build the confidence that allows someone to laugh freely, to speak without self-consciousness, to feel whole. You will do these things over and over again, and often without recognition and without fanfare. And it will matter profoundly. Go change the world, one patient at a time, one decision at a time, one act of excellence at a time. Congratulations, class of 2026. The profession is ready for you. I cannot wait to see what you do.